my name is Alyssa, and today I'm going to be performing a nutrition-focused physical exam on my patient here, Jessie. So today we'll be focusing mostly on macronutrient deficiencies. So if the patient's not getting enough protein, carbs, fat, and different physical signs you can look for in a patient to see if they are malnourished. So what I would do first is I would walk into the patient room and introduce myself as a dietitian. I would ask them some basic questions about how their appetite's been lately, over the past couple weeks or couple months. Ask them about their usual body weight, if they've noticed any weight loss, if they have had weight loss, if it's been intentional, if they've been losing weight without trying, different weight trends, things like that. So just getting a good background on the patient and what they were like before coming into the hospital. So first I'm going to start by once again just making sure that it's okay for me to perform this exam on the patient. So I would let her know, I would put gloves on and let her know that I'm going to be assessing her physically for malnutrition. So to start out, I'm going to kind of go in different orders since we're focusing on macronutrients. So to start, I'm going to look for different muscle wasting in Jessie. So what the muscle wasting would show is possibly a lack of protein in her diet. So if she's not getting overall the proper amount of calories or she's not getting enough protein, then she's gonna have a loss in her lean body mass, and there's a lot of different parts on the body where we can assess this. So the first one is going to be the temporalis region. So what you would do is you would just take your fingers and kind of press around for that temporalis muscle, right on the sides of her eyes there. And so if there's any scooping, if there's any depression, that would show that the muscle there is wasting. And a lot of times you can see that as well just by looking at the patient. So another place where you can see muscle wasting is at the clavicle. And so if the patient is wearing a gown in the hospital, you can just kind of tell them you're going to pull it to the side and kind of feel their clavicle region, feel for the muscle on top of the clavicle to see if that's still there. A lot of times you can assess this just by looking at the patient as well. You can see a scooping or muscle loss above the clavicle. If it's prominent, if the bone is sticking out, that can show different degrees of malnutrition as well. So once again, that muscle loss could possibly mean a lack of protein in the diet. So another spot we could look for is the scapula. So you would just ask the patient if they are able to just sit up a little bit, and so you would assess the scapula in the back, so you would feel for that bone. There's a muscle that lays right on top of the scapula, so you would feel if the bone is protruding more than it would normally, or if you can feel for that muscle back there. And then another place I would check for muscle wasting would be her hand. So I would ask the patient, they can choose whatever hand they want to make an okay sign. So this allows for you to kind of feel for that muscle in between her thumb and her index finger called the interosseous muscle. So if they're not malnourished, if they're getting enough protein, they don't have muscle wasting, you would feel a prominent muscle in between her fingers there. Another spot you can check for is their posterior calf. There's a muscle that lays back there. So I won't ask her to hold her leg up, but a lot of times if the patient is laying in bed, you can ask them to kind of prop their foot up, and then you can feel underneath their calf for any muscle wasting. And then a lot of times you can tell visibly if there's any wasting in the region around the knee or in the calf. A lot of times you might see their bones sticking out further than they would in a well-nourished patient. So other places you might be able to check for that are hiding a protein deficiency would be the patient's hair or their nails. So a lot of times if their hair is brittle, if they've had hair loss, that could be a protein deficiency, or in their nails if they're brittle, if they're weak, if there's lines going through the nails as well, that could indicate protein deficiency. So now that we've done muscle loss and the protein deficiency for the macronutrient, we'll talk a little bit about fat loss that can occur due to just a lack of overall calories, a lack of carbohydrates, a lack of fat. So if your body isn't, if you're not consuming enough carbohydrates, your body could start burning fat for fuel, which could cause fat loss in multiple different areas. And so one of the spots where your body could pull fat from to burn would be the orbital region. So if you're performing an exam on a patient, you would just feel right underneath their eyelid, their bottom eyelid, and there should be some fat padding right underneath there that should be there if they're well nourished. If not, you might feel more of their bones sticking out. Another spot you could feel for fat loss would be underneath their arm or their tricep. So you just ask the patient to hold their arm at a 90-degree angle. And what you do is you would separate the muscle from the fat. And if you feel that there's a good amount of fat underneath there and your fingers aren't touching when you pinch it, that's a good sign that there's no fat loss there. If you're feeling a lot of skin, if there's a lot of just extra skin there that's kind of like sagging down, there's no fat there, that could be a good sign that the patient is malnourished. Another spot where you can look for fat loss would be in the back. So once again, you would ask the patient to lift up, and if you were doing a normal straight through physical focus exam, you could do the back all in one go, so you wouldn't have to ask them to lean up again. But for the back with fat loss, you would just look for if you could see their spine easier, if their spine's protruding a little bit, if you could see their rib cage when they lean forward, that could show loss of fat back there, once again, just from not getting an overall good amount of calories or fat. And so another piece of the physical exam that you could do as a dietitian would just be assessing for any edema. So generalized edema is another criteria to diagnose patients with malnutrition. And so a lot of times this could occur from the patient not getting enough electrolytes or micronutrients, which could also stem from not eating enough of the macronutrients. And so little things like that can kind of help you diagnose whether or not a patient is well nourished or if they are malnourished. So yeah, that's how I would do a NFPE focusing on macronutrients.